Welcome to the deep dive. Today we're going to be focusing on minocycline.
Yeah.
Specifically, its neuroprotective potential.
Right.
And we're going to be focusing on the practical applications for all you healthcare providers and medical residents out there.
It's definitely a hot topic right now.
It is.
There's a growing buzz around minocycline as a neuroprotective agent.
Yeah.
Especially for things like focal cerebral ischemia and traumatic brain injury.
So,
You've got a ton of research to cover.
yeah, I know you're probably all thinking out there, minocycline? Isn't that just an antibiotic?
Right?
Well, yeah, but get this. It has some surprising additional benefits.
It does.
So we're going to be looking at two major review papers.
Yeah.
One from neuroregeneration research
Okay.
and the other from neurotherapeutics.
Right.
And these are both really, really in-depth reviews.
The neuroregeneration research one especially,
Yeah.
they analyzed something like 35 animal studies and 6 clinical trials.
Wow, that's a lot.
A lot of data to go through.
And results were really fascinating.
Yeah, they were really compelling.
So minocycline consistently demonstrated an increase in neuronal viability
Right.
and a decrease in infarct volume after an ischemic event.
And what's really interesting is
Yeah.
the way it does that.
Yeah, how does it do that?
It's through 3 main mechanisms:
Oh, wow.
anti-inflammatory, antioxidant, and anti-apoptotic action.
Wow, that's a lot.
So that's like a triple threat against neurological damage.
Okay, so let's break those down one by one,
Sure.
starting with anti-inflammatory. How does minocycline tackle that?
Well, think about microglia.
Okay.
Those resident immune cells in the brain,
Yeah.
they rush in to help when there's injury,
Oh.
but sometimes they can actually end up doing more harm than good.
So they're like well-intentioned, but
Exactly.
a little too enthusiastic.
Right. Oh,
And so minocycline comes in,
Mhm.
and it's a really potent inhibitor of microglial activation.
So it calms them down.
Exactly.
Okay.
It kind of like tells them to chill out a little bit.
Yeah, so that they don't have that excessive inflammatory response.
So it's like preventing them from going overboard.
Exactly.
Okay.
And that leads to a decrease in the production of those pro-inflammatory cytokines,
Mm-hmm.
like TNFi and IL-1,
Which are,
notorious for causing a lot of damage.
yeah, wreaking havoc in the brain.
Exactly.
Yeah.
And it doesn't stop there.
Ugh.
Minocycline also inhibits KOX2 and MMPs,
Wow.
which further helps dial down the inflammation.
So it's like a
Multi-pronged attack.
yeah, a multi-pronged approach. It's like an orchestra
Exactly.
of anti-inflammatory effects.
It is.
Okay, so what about its antioxidant powers?
Right.
How does it deal with those free radicals?
So we know that reperfusion injury often follows an ischemic event.
Okay.
And that's when oxygen rushes back into the tissues.
Right.
But ironically, it can
Yeah.
cause more damage.
Because of those free radicals.
Right, because of those unstable molecules,
Yeah.
free radicals.
Those little troublemakers.
Exactly. They love to cause havoc. Yeah. But minocycline, it comes in, it acts as a powerful free radical scavenger. Oh, it's like a little Pac-Man going around and eating them up. Yeah, it's like a cellular superhero. Exact. Going in and just disarming those free radicals.
And it's got a secret weapon.
Oh,
It's got this phenolic ring in its structure,
okay.
which gives it that amazing antioxidant capability.
Oh, wow. So it's like built in
Yeah, it's built right in.
to its structure.
Yeah.
Wow. Okay, so last but not least, we've got the anti-apoptotic action.
Right.
What's going on there?
So apoptosis is essentially programmed cell death.
Right?
It's a natural process.
Yeah.
But after an ischemic event,
Yeah.
it can go into overdrive.
Uh-huh.
And that can lead to a lot of neuronal loss.
Okay.
But minocycline comes in and inhibits this neuronal apoptosis.
So it's like giving them a second chance?
Exactly.
Okay.
It prevents those cells from going down that path of no return.
Yeah.
And it does that by working through both caspase-dependent and independent pathways. So it's got multiple ways of
Multiple weapons.
achieving that.
Exactly.
Okay, so we've been talking about focal cerebral ischemia,
Right.
but let's turn our attention to traumatic brain injury.
Okay.
And the review in neurotherapeutics really highlights minocycline's potential in that area.
Absolutely.
So one of the key things that makes minocycline so effective for treating TBI is its ability to cross the blood-brain barrier,
Right.
which is amazing.
It's like having a medical SWAT team
Yeah,
that can get right to the injury,
exactly. So it can get right there where it needs to be to do its work.
right to the scene of the crime.
Yeah. And the preclinical studies are amazing.
They are really remarkable.
They're showing improvements in neurological function,
Yeah.
reductions in lesion volume, and they're even showing evidence of enhanced neurogenesis.
Wow.
So not only is it protecting neurons,
Right.
but it could also be helping to create new ones.
It's like giving the brain a whole new lease on life.
That's incredible. It's so exciting.
Yeah. But keep in mind, these are preclinical studies,
Of course.
so we still need those clinical trials.
Right. We got to see how this translates to humans.
Exactly.
So the preclinical findings are really promising.
They give us a lot of hope.
Yeah, but the real test is how it performs in humans.
Absolutely.
Okay, so what does the research say so far about the clinical applications of minocycline for TBI management?
Well, the clinical data is still limited, but we are seeing some promising trends.
Okay, good.
For example, some trials have found minocycline to be safe in TBI patients.
Okay, so it's safe.
Yeah, and there was even a trend towards improved disability scores.
Oh, wow.
So that's a really good sign.
So safety check mark and hints of effectiveness.
Yeah, exactly.
Okay, what else do we know about its clinical use?
Well, there's some interesting research suggesting that using minocycline in combination with other drugs, like N-acetylcysteine or NAC,
Oh, wow.
could have some really cool synergistic effects.
That's like a
power couple.
Yeah, like a dynamic duo working together.
Yeah.
Okay, so what can this dynamic duo of minocycline and NAC achieve?
Well, some studies have shown that it's quite successful in restoring cognitive function,
Really?
particularly in tasks involving memory,
Oh, wow. That's amazing.
both short-term and long-term memory.
So it's helping with memory.
Yes, which is often significantly affected after a TBI.
Yeah, that's a really big deal.
Absolutely.
Are there any other benefits to this power couple?
Well, the research also suggests
Yeah.
that they can protect those oligodendrocytes.
Oh, now hold on a sec.
Yeah,
For those of us who aren't fluent in neuroscience,
right.
can you explain what oligodendrocytes are?
Of course. So oligodendrocytes are the cells that produce myelin,
Okay.
which is that fatty substance that insulates nerve fibers.
Okay.
So think of it like the insulation on electrical wire.
Okay, so they're like the electricians of the nervous system,
Exactly.
making sure everything's running smoothly.
To make sure those signals can travel efficiently throughout the brain. And after a TBI, these oligodendrocytes can get damaged,
Oh, no.
which leads to demyelination
Okay.
and impaired brain function.
So that's not good.
No, it's not.
So the fact that minocycline,
Right.
especially when paired with NAC,
Yeah.
can protect these cells and promote remyelination
Yeah. It's amazing.
is a really big deal.
Huge plus.
It's like they're not only repairing the damage,
Right.
but they're also rebuilding that infrastructure
Exactly.
for better communication.
It's like giving the brain a makeover.
Wow, that's amazing.
Yeah, it is.
So where does this leave us? What's the
Okay.
bottom line for all our listeners out there who are on the front lines of healthcare?
Yeah, good question.
So it sounds like minocycline and NAC,
Yeah.
like a really powerful combination.
They are a great team,
Yeah, for neuroprotection.
especially after TBI.
Yeah.
It's incredible how it can impact recovery.
Yeah, it is.
But thinking practically.
Yeah. What about dosing?
Right.
We know that minocycline is typically used as an antibiotic.
Mm-hmm.
So do we need to adjust that when we're using it for neuroprotection?
That is a fantastic question.
Yeah.
And it's definitely something providers need to think about.
Yeah.
So the research suggests that higher doses of minocycline
Okay.
might be needed
Okay.
to get those neuroprotective effects.
Compared when you're using it as an antibiotic.
Exactly.
Okay, so it's not just a
Not a one-size-fits-all.
one-size-fits-all kind of thing.
Right. You have to tailor the dose
Yeah.
to the patient and their condition.
To their specific needs.
Right.
Okay. And of course, talking about patient-specific factors, things like age, weight, overall health,
Absolutely.
all that needs to be considered.
You've got to find that balance
Yeah.
between benefit and risk.
Right, right. Okay, well, speaking of risks, let's talk about safety.
Okay.
We know minocycline is generally well tolerated as an antibiotic.
Yeah.
But what about at these higher doses that we're talking about?
Right. Are there any concerns there? Well, it's definitely an important consideration. But thankfully, the research is looking pretty good.
Okay.
Both the preclinical and the clinical trials have shown that minocycline is generally safe and well tolerated.
Even at the higher doses?
Even at those higher doses.
Okay, good.
Yeah. No drug's perfect.
Of course not. So
Yeah, there are potential side effects.
Right, and I think it's important to talk about those.
Absolutely.
So What are some of the side effects associated with minocycline?
Okay, so some of the common ones, dizziness,
Okay.
nausea,
Okay.
headaches.
All right.
But the good news is these are usually pretty mild.
Okay.
They tend to go away on their own.
That's good.
Now, in some rarer cases,
Right.
minocycline can cause skin pigmentation changes
Oh, wow.
or even affect liver function.
Okay, so we need to be monitoring patients for that.
Absolutely. Monitoring is key.
Yeah.
So regular liver function tests
Mm-hmm.
and just keeping an eye out for any unusual skin changes.
Right. So like open communication with the patient.
Absolutely.
Making sure they know what to look out for.
Exactly.
And to let you know if anything weird is happening.
Right. And it's also important to think about potential drug interactions.
Right, because patients are often on multiple medications.
Absolutely. So
Yeah.
always a
Yeah.
thorough medication review
Yeah, a really thorough medication review.
is essential.
Okay, so really thorough patient education
Yes.
and careful monitoring,
Those are key.
to make sure that we're using minocycline safely and effectively.
Exactly.
Okay, so now
Yeah.
I want to emphasize that
Yeah.
while minocycline is showing all this promise
Mhm.
as a neuroprotective agent,
Right.
more research is always needed.
Always more research.
So what are some areas
Right.
where further research is needed?
Well, we need those larger, well-designed clinical trials
Right.
that specifically look at minocycline's effectiveness for different neurological conditions.
Yeah.
We need to go beyond
Yeah.
those promising trends
Right, from those smaller trials.
and get some really definitive answers
Yeah.
about things like optimal dosages, treatment duration,
Right.
long-term effects,
Absolutely.
and how it works in different patient populations.
Yeah, so much more to learn.
It's like a puzzle,
Yeah.
and we only have a few pieces.
We just need more pieces.
Exactly.
Yeah, and what about the role of combination therapies?
Oh, yeah.
Like with NAC,
That's a big one.
does that warrant further investigation?
Absolutely.
Okay.
The preclinical data is really exciting,
Yeah.
but we need those clinical trials
Right.
to back it up
Yeah.
in humans.
Right.
We need to see how these drugs work together,
Mm-hmm.
figure out the best doses,
Yeah.
and really understand the safety and efficacy.
So lots more to explore.
A lot more to explore.
But it sounds like the future of minocycline in neuroprotection
Mhm.
is really bright.
Oh, yeah. It's a bright future.
It's so exciting.
It's like we're seeing a whole new way of approaching neurological care.
a paradigm shift.
Exactly.
But even as we embrace these new possibilities,
Mm-hmm.
we got to remember personalized medicine.
Oh, absolutely.
Every patient is different.
Unique.
Yeah. And their treatment plan
Right.
needs to be tailored to their needs.
It's not one size fits all.
Right.
You got to consider everything.
Everything.
Medical history,
Mm-hmm.
potential drug interactions.
Yeah, all of it
All of it.
to make the most informed decisions.
Absolutely.
Okay, so for our listeners
Yeah.
who are healthcare providers,
Mm-hmm.
medical residents,
Right.
what are the key takeaways they can apply today,
Right now.
even as we're waiting for more research?
Good question.
So it sounds like we're really on the cusp of something big here.
Yeah. It's a really exciting time.
Yeah, a new era for neuroprotection.
Absolutely.
And minocycline is playing a starting role.
It really is.
But, as we've been talking about,
Mm-hmm.
we need to be cautious.
Right. A balanced perspective.
Yeah, we got to harness the potential,
Mm-hmm.
but also be mindful of the limitations. So for those of you listening out there who are on the front lines of patient care,
Right. Yeah.
what are some key takeaways you can use right now?
In your practice.
Yeah, what can you do today?
So here's what I think is most important.
Okay.
First, shift your thinking about minocycline.
Okay.
It's not just an antibiotic anymore.
Right.
Think about all those properties.
Yeah.
Anti-inflammatory,
Mhm.
antioxidant, anti-apoptotic.
Yeah.
And think about how you can use it for those neurological conditions like
Mhm.
focal cerebral ischemia,
Hmm.
traumatic brain injury.
So it's like we're adding
Yeah.
a new tool
A new tool in the toolbox.
to our toolbox.
Exactly.
And like any tool,
Right.
you got to know how to use it.
You got to know how to use it properly.
Right.
So think about those mechanisms of action we talked about.
Yeah.
When you see a patient with a neurological injury,
Mm-hmm.
ask yourself, could minocycline help here?
Could it help?
Yeah. Could it reduce the inflammation?
Mm-hmm.
Could it fight those free radicals?
Yeah.
Could it stop those brain cells from dying?
Those are really good questions.
These are the questions that
Yeah.
can guide your treatment decisions.
So it's about having that awareness.
Awareness is key.
Yeah.
And thinking about minocycline
when
you're making those treatment decisions.
Right. And what about dosing?
Oh, yeah. Dosing.
Any tips there?
So remember those neuroprotective doses?
Yeah.
Their medical history?
All of it.
All those factors.
All those factors matter.
Okay, so finding that sweet spot.
Yeah, that sweet spot.
Between benefit and risk.
Exactly.
And speaking of risk,
right.
Let's talk about safety again.
Safety is always important.
So important.
Even though minocycline is usually well tolerated, you got to be on the lookout for those side effects.
Right.
Talk to your patients about the common ones.
Like dizziness. Nausea.
Headaches.
Headaches, exactly.
Those are the common ones.
Those are the ones you see most often.
And usually they're mild.
Usually pretty mild.
And they go away on their own.
They tend to resolve themselves.
Yeah.
But you also got to be aware of those rarer ones.
Right.
The ones that are more serious, like those skin pigmentation changes.
Yeah.
And don't forget about those drug interactions.
Oh, right. Drug interactions.
Always important.
Always important.
Because patients are often on so many medications.
Yeah, polypharmacy.
Exactly.
That's a big issue.
Yeah. So always do a thorough medication review.
Thorough.
Really thorough.
Okay, so communication and close monitoring.
Those are essential.
So important for patient safety.
I couldn't agree more.
Okay, and before we wrap up,
I
want to touch on those combination therapies again.
Okay.
We talked about minocycline and NADC.
Right, that dynamic duo.
The power couple.
The preclinical data is really promising.
It is.
It's suggesting that combo could really enhance neuroprotection.
Yeah.
But we need those clinical trials
in humans
to confirm it.
To see if it really holds up.
And to give us some guidelines.
Guidelines for how to use it safely.
And effectively.
Right.
So I guess cautious optimism.
Cautious optimism.
And staying informed.
That's the key.
Yeah.
Stay up to date on the research.
Well, this has been a really fascinating deep dive into minocycline.
It has been.
We have explored so much.
We've covered a lot of ground.
Mechanisms of action, safety, clinical applications.
All with a focus on practical takeaways.
The healthcare providers.
Exactly.
The medical residents.
The people on the front lines.
Yeah, and, you know, even though we've talked about a lot, there's still so much more to learn.
Oh, absolutely.
About minocycline's potential.
This is just the beginning.
Yeah, just the tip of the iceberg.
I encourage everyone listening to dive into that research.
Yeah, go check out those sources.
We've got all links
in the description below.
In the description.
Read those studies.
Stay curious.
Yeah, and let us know what you think.
Yeah, share your thoughts.
Your insights.
Your experiences.
In the comments.
We want to hear from you.
Yeah, keep the conversation going.
Let's learn from each other.
All right, thanks for joining us on the deep dive.
Thanks, everyone.
Disclaimer and bibliography in the description.